Getting diagnosed with rheumatoid arthritis can feel like stepping into a roller coaster you never signed up. From the strains, aches and pains to finally hearing the word from your doctor, you have rheumatoid arthritis. The journey is full of twists and turns. Today, we are talking about what it's really like to be diagnosed with rheumatoid arthritis. The physical, the emotional, and everything in between. Let's talk more about how we get this journey. For many people, it starts with small nagging symptoms. The morning stiffness that lasts longer than usual. The swelling of the fingers that won't bend. Or the fatigue that just won't go away. At first, it's easy to brush it off. Maybe it's just a stress, or maybe you slept in a weird position. But over time, the pain and stiffness become harder to ignore. Then comes the doctor's visit. When you visit your doctor with joint pain, stiffness, and swelling, they will start by asking detailed questions about your symptoms. The doctor will want to know when the pain started, which joints are affected, and whether it improves or worsens with movement. They may also ask about fatigue, morning stiffness, and whether anyone in your family has an autoimmune disease like rheumatoid arthritis. These are the questions that will help the doctor to get to the bottom of the problem. Then comes the physical examination, where your doctor will check for signs of inflammation such as swelling, redness, and warmth in your joints. They may gently press on them to see if there is any tenderness, as this is a key sign of inflammation and help in making the diagnosis of rheumatoid arthritis. They will also look at how well you can move your joints, since stiffness is a hallmark feature of rheumatoid arthritis. Then come the utility of the blood testing. Because rheumatoid arthritis can be tricky to diagnose, your doctor will order blood tests to look for signs of inflammation and autoimmune activity. With no single test can confirm RA on its own, these markers help paint a better, clearer picture to make the diagnosis of rheumatoid arthritis. Here are some of the tests your doctor will order, which includes rheumatoid factor. It is an antibody found in about 70 to 80% of the people with rheumatoid arthritis. Though it's very important to consider that it can appear in healthy conditions too. That's why it's not always very specific for rheumatoid arthritis. The next test is anti-CCP test, which is a more specific marker for rheumatoid arthritis, which means if you have this test, it is more likely that you have rheumatoid arthritis. And here are other clues of inflammation such as C-reactive protein, sedimentation rate, or ESR. These measure inflammation levels in your body. Higher levels suggest active inflammation, which is common in rheumatoid arthritis. Your doctor might also order blood counts to check for anemia, which is a common in rheumatoid arthritis due to chronic inflammation. Now, here is the caution. If your rheumatoid factor or anti-CCP test come back positive, it strongly suggests rheumatoid arthritis. But what if they are negative? Well, about 20 to 30% of the people who have rheumatoid arthritis are called as seronegative, meaning the blood tests do not show these markers. That's where imaging study could help in making the diagnosis of rheumatoid arthritis. Imaging tests like X-rays, ultrasound, and MRIs can help doctors see what's happening inside your joints. In early rheumatoid arthritis, X-rays might not show much damage yet, but ultrasound or MRI can reveal early signs of inflammation like synovitis, which is a technical term to describe swelling of the joint lining and is a key features of rheumatoid arthritis. Here are some of the things we'll be looking in the X-rays. X-ray usually shows any signs of joint damage, which is referred to as erosions. Ultrasound is also used in detection of rheumatoid arthritis early in the stage and can also show fluid in between your joints. MRI provides a detailed look at the soft tissues, helping to catch rheumatoid arthritis before significant joint damage occurs. By combining all of these blood tests, imaging studies, and detailed history, a rheumatologist can make a confident diagnosis of rheumatoid arthritis. Catching it early is very crucial because the sooner the treatment starts, the better the long-term outcome. If you are in the process of getting a diagnosis or still looking for answers, don't give up. Keep advocating for yourself, ask questions, and find a good rheumatologist who listens to you. through. The next challenge that might come with the diagnosis of rheumatoid arthritis is the emotional toll on your body and the mind. Hearing you have rheumatoid arthritis can bring a flood of emotions. For some, it's relief, finally, an answer after months or even years of unexplained pain. For others, it's overwhelming. What does this mean for my future? Will I be able to work, exercise, or do things I love? And it's okay. It's completely normal to feel scared, frustrated, or even in denial. But here is the good news. Rheumatoid arthritis treatment has come a long way, and with the right care plan, you can still live a full, meaningful life. Now, you might be wondering what happens after the diagnosis. Once you have a diagnosis, the next step is working with your doctor to create a treatment plan. This includes lifestyle changes and medication like disease-modifying anti-rheumatic drugs or DMARD, which slow down the progression of rheumatoid arthritis. And remember, RA is a journey, not a destination. With the right approach, you can manage your symptoms and continue doing the things you love. If you are newly diagnosed or suspected to have rheumatoid arthritis, know this: you are not alone. There is a whole community out here who understand what you are going through. If this video helped you, be sure to like, subscribe, and share it with someone who might need it. And remember, RA does not define you. You define your destination. And we are here to support in your journey against rheumatoid arthritis. If you have been through this RA journey and the diagnostic process, please share your experience in the comments below. We would love to hear from you. And have you been through the RA journey and the diagnostic process? Please share your experience in the comments below. We would love to hear from you. Please don't forget to like and subscribe and share it with your friends and family who could benefit from learning more about rheumatoid arthritis. Bye-bye.